So, very good afternoon to everyone who's joining us from across the world. It's afternoon in the southernmost part of the continent, South Africa, which I'm based in. I see 67, 68 participants rolling into the virtual house for our Working for Health webinar. We'll give it 30 to 60 more seconds so that everyone joins us and we're ready to kick off our first ever seminar for Working for Health. Thank you. So a very warm welcome to everyone who has joined in, and a very warm welcome to the Working for Health launch and showcase of our very first quarterly seminar. And also a warm welcome to the African continent, which we will be spotlighting today in terms of the health and care workforce. I am Shakira Shinara. I've had the pleasure of working with the Working for Health team for the past 2 years or so, based at the World Health Organization. Together with my colleague Marin Hopp, we'll be taking you through this exciting lineup of speakers, but also a really hugely important topic for today. A couple of tech and tech issues really is one, we've got the chat box for your interaction, for your use. You're welcome to introduce yourself, share your work, share your thoughts, share your concerns and your ideas as well. We then have the question and answer section of the Zoom webinar where we hope you would pose questions to all of us. So keep the questions rolling, keep them coming throughout the webinar. Towards the end of the webinar, we will select 1 or 2 to be answered, as well as answer a few live in the Q&A box. Finally, we're pleased to let you know that we have interpretation, both French and English. So you're welcome to click the little world icon on your Zoom and log in. Again, thanks to 100 plus who are joining us in, and we hope that many more will be joining in as well. So perhaps let's kick off with a poll. It would be great to hear where all 100 plus of you are coming in from across the world. So we've got a quick poll question which will pop up on your screen and ask you, where are you coming from today? Hopefully it's popping up. I don't know, I can't see. Okay. Okay. I see some people popping this in the chat box. There was supposed to be a poll, but nonetheless, we will continue. Keep going. It's great to hear everyone's joining us from the African region, the European region. And yes, continue to share your thoughts and your inputs. As we jump into the first ever seminar for Working for Health, it's quite exciting. And the reason we're doing this is really we're thinking about the past 5 or 6 years, the very starting point of Working for Health. But before that, of course, there was a lot more action on human resources for health, drawing on the High-Level Commission on Economic Growth and Employment, the birthing of the Working for Health program, the establishment of the partnership between the ILO, OECD, and WHO, the establishment of the Multi-Party Trust Fund, and then more recently in 2022, the adoption of the Working for Health Action Plan all the way to 2030 at the World Health Assembly. And essentially what we're seeing is, in 2022, we had a large number of member states supporting the Working for Health Action Plan. So the political commitment is really there. But besides that, the Working for Health Action Plan was co-created with all of you, so many of you listening in, whether it was through consultations with civil society, with the private sector, and also youth organizations. So again, this is one of our first seminar in a planned quarterly series where we hope to spur learning and exchange and really have your ideas, thoughts, and collaboration for Working for Health. When I think about working for health in the past 2 years or so that I've had, or been part of the program, there's a couple of keywords which come to mind. The one is political commitment and traction around the human resources for health agenda. The second is investment and spurring investments at a national level, at a regional level. So through the Africa Investment Charter, the upcoming Africa Investment Forum, and then also thinking about working for health's approach in terms of supporting national level policy development on human resources for health, investment planning again, strengthening the data really, job creation. Some of the examples that stand out for me for working for health is the ability to create jobs and support jobs for women and youth in rural areas across the African continent. Working for health, of course, prioritizes the WHO list of support and safeguards countries. Many of them are in the African continent, actually. And also, focusing on Africa specifically because we're looking towards 2030. We're seeing the universal health coverage agenda, which we need to rally behind massively. But we also know that there's an anticipated shortfall of 10 million health workers, and the majority of those workers being on the African continent. So that's really the scene setting for today. But we're not shouting out what we're doing as working for health. Rather, it's about sharing our approaches, the lessons we have from implementation, and the reason for doing this is for us to coalesce really around the Working for Health Action Plan, but also universal health coverage and ultimately service delivery. So as we go into today's webinar, what does all of this mean? And I think it's a really important point for us to kick off on. And that's what does all of this mean at the practical level for those who are working in the healthcare system as health workers, for those who are on the ground, who are advocating. We'll go into introducing our first keynote speaker for today. But before I do, I see the majority of everyone joining in is from the African continent. So thanks again for joining in. The chat box is really a place for you to share ideas and thoughts. And as we go into the next segment, I'd like to introduce really a young star, a youth advocate, a registered nurse, but also working for multiple organizations, be it the African Union, IntraHealth, supporting work through these various organizations. Sephora, back to you on answering the question really around, what are some of these investments that we have, the policies that we have? How does all of this come together, or how does it need to come together for the health and care work on the ground and for the African continent specifically?
Thank you so much, Chunara, for that wonderful question. And as we all know, the healthcare workforce is the backbone of the healthcare system. So there is no achieving the universal health coverage or achieving health for all without the healthcare workforce. They are truly the ones driving these conversations on the grounds, driving the provision of care and actually leading their communities as we build a safer and healthier Africa. And I see like Africa is projected to have a shortage of 6.1 million healthcare workers by the year 2030. And this already strained workforce is continuing to be strained every other day. We are losing our colleagues to retirement, which is a natural cause. We are losing our colleagues to natural calamities, to war, to the civil crisis that is happening in different countries all across the globe. But we're also losing some of our colleagues to death by suicide. In Kenya alone, we have lost 7 doctors in the last 2 years by suicide. And in the notes they have left behind, they have cited the lack of pay, the lack of employment, the unsafe working conditions are some of the reasons why they have chosen to take their lives. And I would argue that the loss of one healthcare worker is a loss too many. But on top of this, looking at Africa particularly, we are losing a lot of our, especially young workforce, to developed countries all across the board, where they would use Africa as a bed to recruit for their health systems. But then what that does to Africa is that we are now experiencing a severe brain drain. And you see, the young workforce are the ones driving these conversations of the future because they are the leaders of tomorrow. then how do we think about investment in them to ensure that we are attracting, we are recruiting, and we are retaining the very best, so that even Africa is not left in the conversation of building safer, healthier lives, in the conversation towards health for all. And so I would argue that then that investment needs to be maximized, where we are choosing to create safe environments for our healthcare workers. Safe environments mean that they are paid, and they are paid well, that their environments allow them to practice at the top of their profession, that they are provided with adequate resources to provide care, because that's the only way we achieve UHC. But then also those environments support their mental health. And once we make these commitments, once we follow through on this, then we can build stronger workforces. And this goes not just from the community level, but even at the top level. And even as I conclude, I would say that as we are making these policies, as we are advocating to build stronger workforce, then we need to work with the healthcare workers. You cannot leave behind healthcare workers in that conversation. So create spaces for them in the policy, in the leadership spaces, let them be involved, because with them they bring a unique perspective. They are part of the healthcare system, but they're also beneficiaries of health. So they are able to understand their community needs, they're able to understand their needs themselves, and we can build stronger communities and stronger healthcare workforce. And I dare say that please note that insufficient action means that we may not have a strong workforce to lead through health for all. Insufficient action means that we will not achieve UHC. So make sure that we are following through on these commitments. That is not just written on paper that, oh, this is what we want to do for the healthcare worker, but we are actually on ground doing these things with the healthcare worker to ensure that we achieve healthcare for all. Thank you.
Sephora, thank you for shedding a spotlight on really important issues and really strong issues, thinking about the deaths of healthcare workers, the mental health of healthcare workers, thinking about the loss of healthcare worker lives, and also safe environments. These are really critical issues, and it's a really important part or point for us to depart from for this webinar/seminar is how is it that everything that we do translates to action on the ground and better conditions on the ground? So thank you for that. And with that, I hand over to my colleague, Maren Hoff at ILO, to take us through the next segment of this webinar.
Thank you very much, Shakira, and also a warm welcome from my side. My name is Maren Hoff. I work at the International Labour Organization in Geneva. I've been with the Working for Health program for around 5 years now, and it's a great pleasure to see you all participating in our very first exciting new webinar series. Also from my side, a big thank you to you, Sipora, for your very powerful words and insights. I think you highlight, as Shakira mentioned, that it's not only about increasing the numbers, but ensuring that the health workers, health and care workers are supported, they are protected, they enjoy rights at work, and that they enjoy decent working conditions. I think it's evident that many of the points that you raised will actually resonate with a lot of what other speakers today will highlight. And I'm very much looking forward to further engaging in this very important discussion. And with this, let's now dive into our first session, which promises to be both insightful and impactful. And we have the honor of being joined today by distinguished speakers from the International Labour Organization here in Geneva, the Organization for Economic Cooperation and Development, the OECD in Paris, and the UN Multi-Partner Trust Fund Office in New York. And our distinguished speakers will shed light on the added value of the ILO OECD WHO partnership in implementing the Working for Health program, including the pooled funding mechanism that is behind this partnership and the broader impact and future actions that we can take jointly in order to move this agenda forward and to ensure that the impact is actually at the health workers and that there will be an improvement of the situation. So without further ado, let's turn to our first speaker, Frank Hagemann. Frank Hagemann is the director of the Sectoral Policies Department at the ILO in Geneva. Frank, you have a lot of experiences in shaping policies and programs to enhance economic opportunities and to improve working conditions across various sectors. You have worked for the ILO for many years at country, regional, and global level. Now, looking at the work in the health sector, could you please tell us what 1 to 2 key multi-sectoral workforce initiatives are the ILO implementing in close collaboration with the partners OECD and WHO to enable and support countries in the African region, and that are pushing forward the global agenda and uptake of the decent work agenda and the social justice agenda for the health sector and the broader care economy? Thank you. Frank, over to you.
Thanks very much, Maren, and thank you so much also to Shakira and all those behind the scenes who have made this important webinar possible. Hello to all of you. I understand we have listeners, viewers, participants here from across the globe, and of course, greetings to my fellow panelists in Paris, I understand, and in New York. Thanks perhaps also are due at the outset to our two sister agencies, WHO and OECD, for all the good work we have been doing together over the past few years, and we still intend to do together in the years to come. And I think a word of gratitude is also in order to our funding partners in the previous ones, as well as those in the next phase. I don't know whether they are joining us, whether they are here, whether they are listening to us, but we consider this program as a very successful venture and a very successful way of bringing policy coherence to our work in the field, and we very much hope that we can count on further and more support from funding partners and donors. Now, let me give you a glimpse. There's unfortunately not more time, 2-3 minutes, I was told, a glimpse of what we have been doing in the field. Now, during the first phase of the Work for Health program, the ILO, with its partners, assisted governments, social partners, and with social partners, I mean, of course, workers and employers organizations, and other key stakeholders in mainly 8 countries in Africa, and then 2 economic communities, namely SADC and WEMO, in a number of areas of work, including, let me just run you through some of these areas, including the development of multi-sectoral health workforce strategies, the promotion of decent work and rights at work, job creation initiatives, and I think that was mentioned also by the previous speaker. Then the whole area of education, training, and skills, social protection, which I think is has risen in the global agenda, and luckily so. Social dialogue, and finally also what my fellow panelist, the one before me, mentioned, labor migration, and to work against the brain drain, or to manage the brain drain perhaps in a better way. Let me underline here that it's important to take this multi-sectoral approach to health and healthcare workers because they ultimately work in very complex systems, and they face critical health, social, labor, and economic challenges, which are often kind of intersecting. As other speakers will probably explain in greater detail, in the SADC region, for example, we championed a multi-sectoral approach through a successful tripartite technical workshop on health workforce investment and decent work in the health sector. This gathering, which we facilitated as the ILO, brought together ministries of health and labor, and then employers and workers representatives. So basically organized workers, trade unions, as well as the employers. And the outcomes finally significantly contributed to the development of a joint and comprehensive SADC health workforce strategy, and ultimately, therefore, to strengthen collaboration and coordination mechanisms for promoting decent work in the health sector. Now, at the country level, I mentioned we have been working at in some 8 countries in Africa. At the country level, let me just flag something from Chad. In Chad, we have been actively supporting the multi-sectoral committee, which includes key ministries, as well as representatives from, again, workers and employers in the health sector. Through this committee, the program, together with the government, delivered training on occupational safety and health, and it reached out to more than 200 workers and other partners. We developed, for example, control sheets for work inspections and health facilities, which are now used by the Labor Inspectorate, trained social partners on how to strengthen social dialogue, and overall an improved labor relations, and developed, a national health workforce strategy. And then there is, perhaps I should mention that as well, then there's a work in Kenya, where our program trained partners on social dialogue to strengthen peaceful industrial relations in the health sector, which is an important initiative of the Ministry of Labor. I think these, I could go on and on. Obviously, there are 8 countries, a number of initiatives, very important work we've done with our partners, and of course together with OECD and WHO. But I think just the glimpse of these few cases clearly demonstrate that a holistic, multi-sectoral approach can really strengthen health worker outcomes, productivity, and protection ultimately, especially by ensuring voice and participation of employers, workers, and other stakeholders, so that they can play an active role in shaping their health and healthcare systems and service delivery. Thank you very much, and over to you again, Maren. And thanks again for the opportunity.
Thank you. Thank you very much, Frank, for these very important insights. And as you mentioned, there is so much more to share, and we hope that we will be able to get a glimpse of all the other areas of work that we're not able to touch here in our forthcoming webinars. But I think it's very important what you mentioned, the approach of multi-sectoral engagement and bringing all those concerned together and have a collaborative effort like the Working for Health program and the partnership to enhance and promote a strong health and care workforce in the African region. So thank you very much, Frank, once again. Let's turn to our next speaker, Stefano Scappetta. Stefano is the Director of the Employment, Labor and Social Affairs at the OECD in Paris. Stefano, you are leading the OECD work in a number of areas, including employment, labor, migration, health, skills, gender, and also tackling inequalities. And you have been part of the Working for Health program since its beginning and even before. Well, we know and appreciate that you have likely a lot of valuable insights to share. May I kindly ask you to highlight an example of one of the key global initiatives this joint program and partnership has implemented, and the impact that this is making, particularly in the African context, and how this work can be effectively leveraged and supported and sustained by governments and implementing partners. Thank you. Over to you, Stefano.
Thank you very much, Maren, and thank you also to Shakira for moderating this very important webinar. Let me also start, like Frank said, by also thanking for what I think has been a super important and effective collaboration with our colleagues from WHO, with the ILO, but also with the Multi-Partner Trust Fund, and I'm glad that Holger is also with us today. Actually, let me start with one of the observations which I very much appreciated from Zipporah. She said that basically improving the health workforce has to be and is a very critical element in making progress on sustainable development goals and improving the resilience of the health system. In fact, less than a month ago, we had a ministerial meeting at the OECD, and I think all ministers from around the world reiterated the urgent need to address the structural challenges related to the global health workforce, to manage migration appropriately, to expand training and improve skills, and I shall say again, at Zipporah point that she made, improve working conditions, including addressing some of the mental health issues, which unfortunately we have seen actually become even more severe during the pandemic. These issues, of course, in my view, are relevant for all countries, but perhaps are particularly relevant from the African countries. Let me just give you a few examples of the work we have done and how relevant this is also for many countries in the African continent. First is on education and training. We have been reviewing, for example, young people's interest in pursuing careers as doctors and nurses post-pandemic. Attracting young people, of course, is essential because we have a shortage of health workers, but we have to understand what are their wishes, what are their expectations about joining the health professions. Another critical project we have been working on is also aimed at broadening the access to health and care occupation by identifying also what can be flexible education and training pathways, and to develop a guidance on adapting and applying successful education and training pathways model to new country context. I think, again, the digital technology can be a major tool to actually better tailor training and retraining programs and make them more suitable for different individuals, for different workers, but also for different parts of the health profession. The second is that we don't need only to invest on formal education. We need that desperately in all countries, including the African continent, but also we have to adapt the skill of those already into the labor market, already in the health sector. So equipping health workers with the right skills is essential to respond also to future crises and in preparing for increasing use of the digital technology and also to address demographic changes. Effective skills anticipation and the assessment of what is needed in the health sector, in my view, it's essential because we have a quantity issue. We have to invest, we have to have more workers in the health sector, but we have to have actually workers with the right skill to be able to perform the tasks that will be needed. We reviewed methods being used at the national and sub-national level to anticipate the skill needs in the health sectors, including also in a number of African countries. And the third very important point is the one about international migration. According to the latest statistic we have available, 24% of practicing doctors in the OECD countries are actually foreign-born, and 90% are foreign-trained. When we look at nurses, 60% of them are foreign-born and 9% are foreign-trained. Many of them actually come from the African continent. So while migration is a reality for all countries, OECD and other destination countries need to ensure that the workforce capacity in more vulnerable countries, particularly from the lower income countries, is not depleted. We cannot possibly satisfy the needs of more doctors and nurses by depleting, to some extent, countries, especially low-income countries, for very much needed doctors and nurses in their own country. So we have been monitoring recent trend in migration by country of origin for both doctors and nurses, and we have developed what we think are important guidelines for sound bilateral labor agreement to better manage the mobility of health professionals in accordance with WHO code principles, while supporting, of course, OECD countries to improve policies regarding the assessment and the recognition of foreign qualification. Another important point, to make sure that those who move into the OECD countries get their qualification be fully recognized. So I think that collectively our organization helping to address, on the one hand, the global shortage of health workers, by really putting forward a mutually beneficial approach that benefit sending countries, receiving countries, but actually foremost, I think, doctors and nurses and the health professionals around the world. Thank you.
Thank you. Thank you very much, Stefano, for this very insightful points, and which actually I think really nicely underscores the critical role of the global initiatives and the global challenges that the health workforce is facing, and how addressing these in all levels at the global, regional, and country level is important to move forward and to promote and support all the challenges, including skills, education, addressing the health workforce migration aspects, etc. So thank you very much for this. Now, the Working for Health program would not be possible without the support of the donors. It has been alluded to already, and it is supported by a so-called multi-partner trust fund. And we are very much delighted to have Olga Aleshina from the United Nations Multi-Partner Trust Fund office in New York with us today. Olga, you are a senior portfolio manager of the UNMPTF office, which is a UN Center for Expertise on Pooled Financing Mechanisms. So you have been involved in many of these projects and programs, and we're very happy to have you here, and would like to ask you if you could give in a 2 minutes, maybe please highlight the value of the Working for Health pooled funding mechanisms in terms of efficiencies and effectiveness, its broader impact and future actions, and why you think donors and partners should step in and support the agenda. Olga, over to you. Thank you for joining us.
Thank you so much, Maren. Good afternoon, good morning, colleagues, and great pleasure to join you from New York. It's a very important first webinar, so hopefully we'll have more to come. Please allow me to offer a few reflections why I believe the Working for Health Fund has been a great instrument to support the Working for Health agenda. So first of all, as Maren had said, it's an interagency mechanism. So that mechanism was established in 2018, in May 2018, when 3 agencies, WHO, ILO, and OECD, came together to deliver on the common objective. The fund has been very generously supported by Norway, Switzerland, UK, and Silotech, who invested in the Working for Health Trust Fund. The fund has been a unique and strategic instrument. It has facilitated a joint action among WHO, ILO, and OECD at country, regional, and global level, really connecting the country level work to the global expertise and the normative agenda of the agencies. Through this, it built the ecosystem of partnerships. So now where so many of us are discussing the Africa achievements, the economies of scale has been another big highlight, as well as synergies and alignments that the 3 agencies brought together. So the work really galvanized the action that we have heard and will hear in this seminar. 1 + 1 + 1 in this equation equaled 5, right? The whole has become much greater than the sum of its parts of the agency's contributions to this mechanism. So each agency brought their comparative advantages, sequencing their interventions, creating the value chain, enabling the execution of the versatile development strategies to accelerate the transformations. So the fund now celebrates its 5-year milestone with many achievements. As we'll hear further, that the fund has been incredibly catalytic in terms of investing and acting in 19 countries, right? With 6.4 million of the overall investments in the fund, it has reached 19 countries. It stimulated incredible transformations, policy transitions, support with investment plans, supporting creation of the healthcare jobs, assessing and improving job conditions, developing courses for healthcare educators, to name just a few. So in addition, the fund has been very catalytic. It brought the issue of health and care workforce high on the agenda of the national governments. As a result, we have all seen the leveraged domestic resources. We have seen additional bilateral resources coming into this agenda, as well as the investments of the multilateral development banks. So as we're concluding this first phase, I think there's a lot of lessons that have been learned, and the fund is really ready to operationally scale up its ambition and its capacity to deliver greater products to many more countries. So to achieve its full potential, the Working for Health Trust Fund needs resources from both existing as well as new supporters, which will be put to good use to design programs to strengthen the health and care workforce in many more countries in support of the Sustainable Development Goals. Thank you so much. Over to you, Maren.
Thank you. Thank you very much, Olga, for enlightening us and for also your very valuable food for thoughts on how we can collectively strengthen and how it has been done and what are the future opportunities to work collectively and raise the awareness of the health workforce agenda. So thank you very much. And I would also like to thank once again all the speakers of this session for their invaluable insights and contributions. This has been very, very great. And unfortunately, we're running a bit out of time, but that is why I would now, without any further redo, I will hand over to my colleague Meredith Van Ulen from the WHO to give us a brief overview of the Working for Health program and the learning and implementation report that we've developed from the work that we've done in the past 5 years. Meredith, over to you.
Thank you so much, Maren. So we've heard from Frank and Stefano and Olga, who have given us really the framing of Working for Health within the broader health workforce agenda, and also from these multi-sectoral perspectives. Sephora has also given us the context of what it means to be a health worker in Kenya today and to meet the challenges that she's facing, for example, mental health and working conditions of her colleagues in the health workforce. And I just want to say their lived experience is really the driving force behind Working for Health. Next slide, please. The Working for Health implementation model provides an integrated health workforce strengthening and investment approach where health workers are firmly positioned as an essential component of national development plans, health policies, and investment plans. And this approach has been enabling countries and partners to really look beyond only the health sector to create these multi-sectoral partnerships with labor, education, finance, and with others like gender to really collectively invest in the health workforce education and skills, employment and retention, and to ensure that access to care and well-being is available to everyone, everywhere. Next slide, please. Over the past 5 years, Working for Health has directly supported 23 countries, 5 regions, and 3 global initiatives. And Working for Health is enabling these countries to access high value and low cost catalytic funding and technical support that directly responds to their key workforce and health systems needs in order to meet universal health coverage and SDG targets, and also to translate these into significant policy action and investment. So for example, by providing decent work and protections for all health and care workers, creating jobs for youth and women, ensuring that high quality health workers are trained, they're motivated, they're well supported in their jobs, and they're retained where they're needed the most. And on the panel today, we will hear from our guest speakers on their lived experience of this work. The Working for Health footprint is vast. It's primarily focused in the African region, where a significant number of the countries with the largest relative health workforce gaps exist. 16 countries that have received direct Working for Health support are also identified on the WHO Support and Safeguards list from 2023. And those are priority countries that should be protective from active international health worker recruitment. Across the Working for Health portfolio, significant progress has been made. And you can see here that the number of countries even goes beyond those 23 that we've supported directly, but also through our regional work and the global public goods. You know, this work is really being scaled up and reaching a number of different countries. And across this portfolio, we're seeing, and we're going to hear soon from our speakers as well, that sustaining and scaling up this critical work is really requiring all governments, development partners, and stakeholders to work together, and also to ensure that health workforce investment agenda is fully resourced, it's supported, it's implemented, and together we can really achieve so much more. Can you please go back to the previous slide? Thank you. Drawing on the Working for Health model and its global reach, here are just a couple of really quick snapshots that I want to focus on. Number one, data. So maximizing the availability and the use of health workforce data across countries and sectors. This really forms a base to inform policy, decision-making, and investment. Number two, dialogue. Bringing together countries from key regional economic zones like the Southern African Development Community, or SADC, who have been committed to one common workforce approach aimed at doubling the health workforce across all 16 SADC countries by 2030. Number three, decisions. So for example, an integrated health workforce investment plan in Benin has secured additional investments for the recruitment of around 4,000 health workers. This is in fact an increase of around 40%. So that means access to essential services is significantly improved in rural areas, and also that the population health needs are being served. Number four is investment. So the application of health labor market analysis has enabled the government of Rwanda to mobilize and secure around $200 million US through World Bank for improved service delivery. And this is including sustained long-term funding to support the doubling of doctors, midwives, and nurses. And number five, impact. Supporting South Africa to develop and implement a new HRH strategy has called for the investment of 97,000 additional health sector jobs. And this will dramatically increase the access and the coverage within the country, and also then have a positive impact on the health outcomes for all South Africans. So let's hear more from our panelists to understand how this approach is working in countries and to see where and how the governments, development partners, and other stakeholders can really come together and commit to investing and implementing a common health workforce agenda through Working for Health. Thank you.
Thank you very much, Meredith. Sorry, Shakira. Yes, thank you. Over to you. for the next session.
Thanks so much, Maren. Yeah, no, that happens totally fine. So thanks again, everyone, for joining in from across the world. Thanks to my co-moderator, Maren, and Meredith as well, for setting the tone and really giving us some insights into the Working for Health program. As we're about to go to the next segment, I want to just give a shout out to regular folks who support the Working for Health program and collaborate with us in different ways. So for example, we've got Kate Tilenko, who's also joined. And then in the chat box, I've seen we've got participants from Nigeria, from the Northwest University in South Africa, and even Masuma Mamdani from Tanzania. So thank you so much for joining in. If you're just joining us now or want to continue engaging with us, feel free to do so in the chat box, but also in the question and answer section. And for all of the speakers / panelists, there's a great list of questions and answers coming in. So feel free to answer this live as we move ahead. You can also find Working for Health on Twitter, LinkedIn, and our respective agencies' websites. So we're going to kick off with the poll, and I'll keep speaking as the poll comes up. The poll is really around, in your opinion, what do you think we need to do to strengthen the health and care workforce on the African continent? As I said, I'll keep speaking to get us into the next exciting segment. We have 4 distinguished speakers, particularly welcoming high-level ministry officials from the Ministry of Health in Kenya. We also have colleagues from the ILO and WHO to take us through this next segment. What's some of the work that Working for Health has been supporting together with countries to strengthen the health and care workforce? What's the investment? What's the action? What do we need to collaborate on and really push collectively? So it's with great pleasure that I introduce on behalf of the broader Working for Health team, Dr. Zainab Gura, the Deputy Director General of the Ministry of Health in Kenya. Dr. Gura, we are so fortunate to have you with us. I hope that there are no tech issues. You can unmute, you can show your camera, and we'd like you to kick off this segment. You know, it would be great to hear, what do you think, what are some of the main HRH priorities in Kenya, possibly even the East African region? What are some of the actions that you will be taking and the interventions which you would want us all to think about supporting in different ways? So without further ado, over to you.
Thank you, Shakira, for that introduction. And indeed, in Kenya, the Ministry of Health and the government of Kenya are focused on achieving universal health coverage. And for us to achieve universal health coverage, then human resource for health is a critical pillar. It's actually the cog in the wheel towards achieving universal health coverage. Here we say and echo the chorus that there is no UHC without adequate skilled human resource for health to provide the quality and affordable healthcare that we strive to achieve for all Kenyans. Therefore, one of the 4 foundational pillars that the Ministry of Health is focusing on is actually human resource for health, along with making sure that we have health, commodity security, we have adequate health financing, and integrated health information systems. So the commitment to strengthen human resource for health is along the continuum of healthcare, starting from the prevention. So we are focusing on the community and preventive healthcare, making sure that we have adequate skills and personnel in that field. We are also looking to make sure that where we have focused originally, curative, palliative, and rehabilitative care is also continued to focus on, so that we have adequate, when Kenyans get to a facility, they will not be able, miss to get care because there are no adequate and skilled health workforce right from the community health. We have prioritized various areas in terms of human resource for health. And the first one I would like to highlight is strengthening information and evidence for HRH decision making. We realized, and with my colleague, Dr. Gondi, who's also on this call, that when we look at how many health workers do we actually have in Kenya, what are our needs, what are our demands. What are our gaps? We didn't have that. So we, together with WHO, we embarked on strengthening our information and evidence for human resource for decision making and programming. And we started, human resource information systems. We did a HLMA, which my colleague is going to elaborate on. We worked on the workforce indicator for staffing needs, and we operationalized the National Health Workforce accounts in Kenya. These combined are giving us very good data for us to even understand what are our gaps and what are our targets and where do we want to be in the next 5 and 10 years. So this has been an important step, and this is a priority for us to continue operationalizing it and also institutionalizing, so that it becomes equally that we strengthen the human resource for information systems and work on our national health strengthening and expanding our national health workforce accounts. So this evidence is now helping us to have evidence-based policymaking. This is one of our priorities for this year, developing a human resource for health policy. It's one that we've not had. So we have a strategy that is in place, and we are going to have a review of that strategy based on the data and information that we have. So it is helping us in having evidence-informed health workforce policies and strategic plans in place. So this is a great step and will be a priority for us moving forward. I'd like to go to our commitment to ensure that there is adequate number of human resources that are skilled and competent to provide the quality of care. Over the last decade, Kenya has been able to double the health workforce density, but we have not reached our target. We also know that we have, when it comes to specialist health workforce, then our numbers are also beyond where we want to be. When we are looking at adequate workforce, the rate limiting step is the fiscal space. We are producing, especially the general workforce, we are producing, we have increased our production, but the ability to absorb them is the rate limiting step. It's the challenge. And we are advocating for an increase in fiscal space from our national treasury, so that we have annual quota for absorbing health workforce to be able to absorb the workers that we produce, because without that we will not be able to achieve the work targets that we are looking at. So advocating for increased fiscal space is one of our priorities as we move forward. We also have commitment from the government to hire. I know we at least 20,000 health workers. The government has also made good on the promise of hiring community health workforce. We have hired 100,000 health workforce, trained, kitted them, and developed an e-community health information system to be able to manage the community health services and the primary healthcare services. So we are advocating to make sure that just as much as we have hired the community health workforce, then we are able to hire the primary healthcare workforce of 20,000 that the government has committed to. And we can only achieve that if we have expanded fiscal space to absorb healthcare workers. This means that we have to look, we have to have that paradigm shift of looking at investing in health workforce as an investment, not as a cost item. So the Africa Investment Charter then has become our tool. We have adopted it, I think, in the year 2002, and we are also using it as a tool for advocacy, so that we are looking at funding for health workforce as an investment rather than a cost item, and working with our treasury to view that and accept our investments plan for human resource for health. As I earlier mentioned, that we have increased our production. But one of the challenges, and we have noted, is the skill mix that we have. We are working on aligning our needs with the supply, so that the people we are producing are actually fit to deliver services in our health system. So that is also one of our priorities. When you talk about that, then you have to expand our collaborations with the Ministry of Education, because training and production is within the Ministry of Education, and we are the consumption, we are the tail end. So we have started engaging with the Ministry of Education so that we discuss what are our needs as health sector, and that needs has to align with the production that are actually manned or managed by the Ministry of Education. That's also one of the, and I'm sure it is a cross-cutting need across the East Africa region. We have increased production. We have limited absorption. So health worker migration is a reality in Kenya. The government of Kenya has looked at structuring health worker migration. We have a migration policy in place spearheaded by the Ministry of Labor. And as you see across my examples of what we are doing, collaboration with other ministries is paramount. I have talked of Treasury, Ministry of Education, now we are at Ministry of Labor, because health work migration per se is the function of Ministry of Labor. So we worked with them to develop the migration policy, and the government of Kenya is entering into government-to-government bilateral agreements to structure the workforce migration, specifically to avoid brain drain and compromising our health system, because we also need our staff. We are not saying there are no other avenues of migration. We know that there are other migration that are happening, but more and more we are educating our health workforce. We are also putting out, supporting the policies to support good remuneration packages and terms, so that the workforce will opt to use the government-to-government arrangements rather than going through other arrangements. This brings me to protection and taking care of our health workforce, which is another priority. My colleague from Kenya mentioned about mental health issues, and it is true that that is a reality. The approach that we are taking is an adaptive and an inclusive approach, where health worker is the central in this discussion, where health worker representatives, the unions and the associations are central in this discussion, and initiated various national social dialogues where we are inclusively discussing what can we do best for our health workers to make sure that they have better terms of engagement, they have better work environment, they have better remuneration, and therefore better packages to improve, to take care of their mental health and well-being. One such, last year we had a declaration, where all the unions and the associations are there. We have 17-point declaration on what the ministry and the government needs to do, what the unions and the associations needs to do, so that we work together. Over the last 2 years, we have significantly reduced the number of industry actions. And this is, again, in collaboration with our partners, and the ILO is one of them, and Ministry of Labor and various WHO and various other partners, we are working together. These are the major areas. I know there are several others. And for us to achieve this, there is that adaptive, collaborative, inclusive approach, so that governments and other stakeholders join hands to make sure that we have increased investment in human resource for health. We review our fiscal space, get better terms and protection and taking care of our health and care workers, in innovative ways of addressing human resource management issues, which we have several at both national and the subnational levels. Thank you, Shakira.
Dr. Gura, thank you so much for setting such a strong scene. And actually, all the priorities you point out and the areas of action closely linked to the poll that we ran, which is around the majority of participants feel that the top 3 priorities for the African continent is safe and decent work, absorption and employment, and addressing the brain drain. I'd like now to call on Dr. Joel Gandhi, who's the director of HRH, to share a few words around the importance of the health labor market analyses and also, its value in driving planning, investments, and really addressing some of these issues which Dr. Gura has addressed as well. I will say at this point that we have exactly 8 minutes remaining in this webinar. So, Dr. Gandhi, if you could be as brief as possible. Thank you.
Thank you very much for giving me this opportunity. I will try to be as brief as I can, and definitely I will not take half of that 8 minutes, promise. I'm going to talk about the labor market analysis. I think my colleague, Dr. Gura, has already highlighted the key issues which are cross-cutting. I just want to say, where does it get us from, so that you can understand the importance of why we had to do this. One, Kenya's governing system is decentralized. So we have national and subnational governments. These governments are somehow autonomous, but interdependent in terms of health workforce. The lower ones recruit, they can deploy, they can contribute into training. The national one makes policies and also runs the national hospitals. Before devolution, these people were managed centrally. After devolution, now we had 47 governments managing human resource for health issues across the country. Two, the issues of training. We know that in Kenya, education and training is a mandate of Ministry of Education, which is completely different from Ministry of Health. Therefore, who to train, how to train, which curriculum to use is independent of the final user, who is the now the health sector. So we combine this, then we realize that one, there were very many multiple information points. If you want to get a complete set of health workforce information, it was almost impossible. Two, then you realize that at times then the need might not determine what is trained. At times the economic and social factors probably will prevail in terms of course, content, and priorities. So when come 2020 now, Kenya did health labor market analysis to just find out a cross point, where are we, and also to look at where do we need to be and probably how will we do this. So when we did this analysis, it was both qualitative and quantitative. The brief is, we realized that in the last decade, we have doubled the number of health workforce in the country with an annual increment of 11% in the stock. And this was something which is commendable. I know very few countries have done this. And we know with that, now we know that we continue at that trajectory. We know that by 2032, we will be able to take care of our 70% of our population needs. We also realized that, of course, with this production, my sister has talked of unemployment. We had about 14% of our health workers who are not employed. They're wishing to employ, they're trained, but they can't get employment. And of course, this is also different based on the cadres. And also with the qualitative aspect of it on intention to migrate. This in health workers who are in level 4 facilities, this is like the district also level facilities, 60% had intentions to migrate, with almost a third of all these health workers saying that they're planning to migrate within the next 2 years. These were some of the key issues that kind of now doing the labor market analysis helped us to find out. And therefore also, why is this important? This has created for us a forum to look at the issues of working and investing smart in the health workforce. The health workers, the population needs are still high, and yet we cannot absorb more because of the constrained fiscal space. So it is helping us to have an investment dialogue on how are we going to meet population needs, where do we get the resources, and how do we get them. So with this now in mind, we are having a dialogue that we believe is going to bring a kind of a national compact of investment on human workforce to help us now include the additional health workers and ensure that we don't have these health workers who are not trained, who are hanging around, who don't have gainful employment. We also realize that we need to now continuously engage with stakeholders, including education sector, training institutions, so that we have health workers who are trained with the curricula which are relevant and for the country and even beyond. And also we look at the issues of the quality of the training. Thirdly, we are looking at the issues of, with this additional staff that we cannot probably gainfully employ currently, do we have options in terms of giving them gainful employment areas where they are needed? And therefore, now we started having bilateral engagement.
Dr. Gandhi, I'm going to have to jump in, or maybe the internet has jumped in. Dr. Gandhi, we literally left with 2 minutes. So if you can wrap up in 10 seconds. Yeah.
Okay. Yeah. So now what I'm saying
Gandhi,
is, one,
could you wrap up
the labor market analysis. Can I stop there? Because yes, I mean, I was wrapping up.
Thanks so much, Dr. Gandhi. It's really good to hear from both you and Dr. Gura, because you're really sharing insights on the priorities in Kenya, the priorities in East Africa, but also the priorities across the African continent. We would love to hear more from you. Really, the chat box is off the charts. We're saving the chat, we're noting the chat. We're now shifting to the last 120 seconds of this first ever Working for Health seminar. Over to you, Simpiwe, for a brief 1 minute. So I don't know if you have time for a presentation, but a brief 1 minute, because a keyword that's come out across this discussion is multi-sectoral. So back to you for exactly a minute.
Yeah, no, thank you very much, Shakira. And as indicated, my name is Simpiwe Mabele. I'm from the ILO. I'm based in Pretoria, but work in East and Southern Africa. So Shakira, listening to the questions and what has been discussed, I thought, let me reflect that the contribution we've made from a multi-sectoral point of view and inclusion of partners and stakeholders. We worked with WHO and SADC in developing the health workforce strategy. Then at country level, it was the human resources for health strategy, but we went further to actually support interventions at sub-national level. And it was one of the provinces in South Africa, Eastern Cape. And I'm mentioning this because though I started working with Working for Health from its inception, but we all know that during its implementation, the COVID pandemic came. So we kind of roped in some of the expertise and resources we have to make sure that we address issues related to COVID. But I think here it's better to locate the health sector within the broader world of work. And I think Frank actually articulated this earlier, where he mentioned that the world of work is complex. So the health sector could be located within what is called horizontal sectors. Public sector, yes, we're referring to government, but there are health workers in the private sector as well as in civil society. But this work that we supported as ILO focus in the health sector within the public service, because we can't look at government as a policymaker only, because government is also an employer. So the health workers that are employed within government, it's important that they are actually covered as well. But there's a question that was on the chat, Shakira, around how does ILO ensure and ensure the connection with other areas of work like K-economy and all that. It is through the international labor standards, because the world of work operates within a normative space. So we bring in the international labor standards. And from a multi-sectoral point of view, one standard that I could mention is Convention 144 on tripartite consultation. And this is what allows us to be able to bring the trade unions on board. So the roles and responsibilities that one could look at, of course, government has to facilitate the ongoing social dialogue and ensure that the unions in the health sector are involved. I know that development partners, yes, technical and financial support, we used one of the jointly developed materials, WHO and ILO health-wise methodology, in ensuring that we improve the working conditions of health workers. But in terms of the impact, and I'm finalizing here, Shakira, the one message that I want to bring across is collective bargaining agreements. We saw the improvement in terms of how workers, they articulate what they would like to see as improvement. And if only this is communicated through collective bargaining agreements, then it legitimizes whatever commitments that are made. So it's important to have that. And they were using messages like, sometimes they feel they are treated as options rather than priority. And it reminded me, actually, the Maya Angelou quote, where she says, open quotes, never make me someone a priority, whereas all you are to them is an option. And I close quote. So I really want to bring across that the health workers, there are times where they feel that they are an option that could be chosen over another option. So let's make them a priority. And thank you to the government of South Africa, particularly Employment and Labor, Eastern Cape Department of Health, and all the unions that participated. Thank you for your attention.
Thank you so much, Simpiwe. And I've just heard from colleagues that we can stay on for a few more minutes without me passing out about time. So that's really, really good. To wrap us up, a couple of key things have come up from this discussion. One is the Working for Health approach, some of its successes, talking around partnerships. So partnerships at that global level between the three agencies, at a regional, at a national level between ministries of labor, health, etc. We've heard a lot around multi-sectoral mechanisms coming out from Kenya, the HRH priorities specifically on the African continent. And all of this, which Sephora at the beginning had really put together and centered around universal health coverage and service delivery. There was a really interesting question in the chat box, and this allows us to now wrap up, but it also answers this question. There was a colleague in the chat box who had posted, it's one thing to develop plans and strategies, but this has not led to investment. And we actually on the African continent, and as WHO and partners specifically working towards an African investment forum. And to close us off, I'd like to invite San Boris from the WHO regional office to give us a snippet of what's to come this year in terms of investment.
Okay, thank you, Shakira. Thank you, colleagues. Thank you for giving me this floor to talk about the investment charter. Here we are organizing for the region. It is planned to on the 6th and from the 6th to 8th May this year. So what is the rationale behind that investment charter? As many of our colleagues presented previously, Kenya and other countries, across all the evidence generated by the HLMA and other within other evidence generated methodology, we came to the conclusion that there are limited fiscal space for investment in health workforce. And the second point is that most of the investment are scattered from different partners. So there is a need to have an investment charter to bring all the partners together so that we can leverage on that one and make more investment. So basically the 5 principles of this investment charter that can bring a change like a paradigm shift is first to ensure alignment of investment by the government. The government has the leadership and the stewardship to reinforce. The second pillar is to prioritize based on the evidence we are producing, to prioritize investment in health workforce. And also the second one is to align all and synergize all the investment in health workforce. So that means we need to have an investment dialogue plan and a compact that aligns all the stakeholders to synergize their investment. The fourth pillar is to stimulate investment. Basically, the idea is a joint investment action and accountability to address health workforce priorities. And the fourth one is to sustain investment, basically to achieve most of the goals, the health goals. So we are planning to organize that investment forum in Namibia from the 6th to the 8th May this year. So this is a good floor for us to talk about it and invite all the stakeholders that can come and also take part of this forum. Thank you.
Thank you so much. It's really, really great to hear from you. I was trying to just share screen as well. Thanks so much, Sam Boris. And there you have it, everyone. Looking forward towards the Africa Investment Forum, which will be happening in May this year. As we heard from several speakers, there's lots of things that we can do, but investments in the health and care workforce still remains critical. As mentioned at the beginning, this is the very first in a series of Working for Health webinars. We will spotlight countries, regions, and the work that we're doing, so stay tuned. Do get in touch with us. A special thanks to our high-level speakers, the different directors of agencies, the Ministry of Health officials, and other esteemed panelists, including our healthcare worker. Thanks for staying on. Do keep in touch. Again, we've had great engagement from you, David Bryden, Benjamin Sofa, Eleanor Hutchinson, I believe, in the question and answer section. And we've also had great inputs and insights and ideas from you in the chat box. We'll definitely be in touch, but stay in touch with us as well. Over and out, adios from myself and my fellow co-moderator, Maren Hoff. Thanks so much on behalf of the Working for Health team.